Hi there. We're going to be looking at some basic cardiovascular screening tools for manual therapists. This is not an exhaustive list, so we're just going to go through some of the basic fundamentals that you can start to incorporate in your clinical practice that may help you sort of have a look at the patient more from an objective perspective and give you an indication as to whether you think that patient may need to be referred to a medical professional. Now, guys, I always look at screening as an important part of the whole process. When that patient walks in through your clinic door, I'm judging them, and I'm judging them straight away. More for what do they look like? How are they presenting themselves? How are they dressed? How are they moving? What's their, are they overweight? Are they obese? Are they young? Are they fit? Are they old? We start getting a picture of this person as soon as they walk through the front door. I always remember the analogy that I was told by a chef, that the first bite is with the eye. And that's the same with clinical practice. As that patient walks through that front clinic room door, you have to be thinking objectively. Look at the patient in front of you, and are there any signs and symptoms that this patient may be systemically unwell? Is this patient someone that I think I can treat, or is this someone who I think, do you know what, I'm going to refer them? And the key emphasis here, guys, is look, you're not Dr. House. You're not going to know everything. I'm very open that I'm happy to refer to my colleagues who may have a better understanding or better training or more knowledge of certain areas than I do. So don't ever be afraid to refer. You'll never be criticized for being cautious. You'll always be criticized for being cavalier. So basic cardiovascular screening. Now, guys, the patient walks in, we are just going to observe them. We're just going to have a little look, see what they're like. Something simple as, look, how's their physical appearance? Are they morbidly obese? Are they significantly out of breath just walking into your treatment room? What's their skin color like? What around their lips, their eyes? Are there any signs of cyanosis, any sort of blue discoloration that may sort of indicate an inadequate oxygen supply? Are they short of breath? Now, they may have run to the appointment. Okay, that could explain it. But if they're walking in and they're sat down and they are literally out of breath just being sat there, that labored breathing, that again is something that I would be looking at. Is this normal for them? Are they normally out of breath all of the time? What's their skin color like? The tone of their skin? Is there any indication that there may be some underlying health considerations? Are they bright red, flush? Is this normal for them, or is this something new? Swelling. Again, we're manual therapists. We put our hands on the patient. We look at them objectively. Any swelling in the hands, in the feet, any peripheral swelling. Again, that's something that I'm always going to be looking at as a possibility of referring. I mean, if the person's coming in and they've got significant swelling of the extremities, something's not right. Now, again, I'm not Dr. House. I'm not going to diagnose something. I'm going to say to them, look, I think this warrants further investigation. And don't be afraid if that person sat there and you're thinking to yourself, this person may be systemically unwell. Don't be afraid to refer them after the case history. There has been times that the patient sat there and I'm thinking, do you know what? I think this is more of a systemic issue. I'm happy to refer. So again, we stand back and we look at them objectively. How are they moving? How are they visually to you? Asking simple questions. Do you have family history of cardiovascular problems? What are your parents? Are they still alive? Are they well? Do you have family history of cardiovascular disease, of strokes? Anything that may indicate that they may be more susceptible to this? Hands as well. So, we look at the patient visually to start with, and then we can start taking more of a closer look. And we can look at their hands, and the hands can give us quite a lot of information. We look at the color of their hands. We look to see whether there's sort of pure, very poor sort of capillary refills. Is there staining around the fingers? Are they a smoker? Remember, you ask your patient lots of questions. That doesn't necessarily mean they're going to give you the right answers. Patients may not they may lie to you. Some patients may not want to say that they smoke, they drink, that they don't exercise, that they're not as healthy as they would like people to think they are. That's understandable. So again, we look for these signs and symptoms. Are their fingers stained? They may be a secret smoker. Xanthomata, raised yellow cholesterol-rich deposits around the thenar, hypothenar eminence. So we're looking to see if there's any discoloration around the hands, the palms, anything that may give us an indication that this person may be systemically unwell. Again, so we're looking at the color of the hands. And again, looking at things like finger clubbing, okay, we can have a little look to see whether the patient has sort of any changes in nail beds. We can get them to sort of do this sort of looking here, getting the fingernails next to each other to see if they are any sort of signs of finger clubbing, looking for signs of splinter hemorrhaging, Janeway's lesions, anything that may indicate that this person has some form of underlying health issue. Temperature. Now, I'm not expecting you to get the thermometer out and stick it somewhere you shouldn't, but testing the patient's temperature doesn't have to be that challenging. You can literally hold someone's left and right hand and just see whether they are symmetrically warm. Are the hands the same? Okay. If one hand is hot and one hand is cold, then we have to start asking questions. Why is this the case? Is there something cardiovascularly wrong with that person? Is this normal for them? We have to start thinking, is this something that we may need to refer on to? Do they have cold hands? Is this normal for them? Because this might not be a systemic problem, but if they're turning around saying, actually, yeah, recently I found that my hands are really, really cold, that may be a sign of poor peripheral perfusion. There could be something that we need to think about. Are their hands cold, cool, sweaty, clammy? Again, is this something that they've just started to experience? Or are they that sort of person that has sort of sweaty palms and that's normal for them? I tend to ask these patients these open questions. Is this normal for you? If it isn't normal for them, then again, that's something that we then may start thinking about investigating further. So we've stood back, we've looked at the patient objectively, we've looked at the hands. Are there any indication of clubbing of the fingers, of splintering of the nail beds? Are they stained because they're smokers? Are there any sort of discoloration? Is there any temperature changes between the left and the right hand? Having a little look objectively at the patient before we've even started to ask any more further questions. Capillary refill is a good one to do. You can see whether the left and the right hand is symmetrically warm or the temperature is equal, and then we can sort of pinch the finger and look to see how quickly the blood returns. Now, you would hold it for about 5 seconds, and then it should return within 1 to 2 seconds, a couple of seconds. It's pretty fast. If it takes a long time for that fingertip to return to normal, we have to start asking again more questions. There could be some sign that there may be something underlying that we need to be investigating further. So we can, again, test the temperature of the hands, quick capillary refill, looking for any changes around the fingers. Something as simple like that can give us a whole host of information about this person's systemic health. Now, a basic eye exam. Now, look, I'm not an optician, okay? I will look at the patient's eyes objectively, and I'm looking for anything that's very, very obvious. Anything that may indicate they have some form of lack of vitamins and minerals. Do they have sort of anemia, pull the eyelids down? Any indication that may be the case? Are their eyes yellow? You know, is there a jaundice issue going on here? Corneal arcus, again, discoloration around the cornea. Xanthelasma, yellow raised cholesterol deposits. Now, again, we're not opticians, but we can objectively look and see what we think is normal. If the patient sat there and they've got significant eye bags, bloodshot eyes, they've got discoloration, they've got changes, they've got visual changes, then I would be personally referring that person to an optician, someone who has got access to all of this fantastic equipment, and they can do a thorough examination of that person. Again, don't be afraid to refer this person. As an osteopath, I was trained to do very, very in-depth sort of OSCE cardiovascular screening. I was trained to look into the eyes and the ears and get my stethoscope out and listen to the mitral, tricuspid, aortic, and pulmonary valves. I don't do that. I look as a very basic screening tool. And if I think that patient warrants further investigation, then I will refer that person to a medical professional, because unless you're doing these sort of very in-depth screening tests on a very regular basis, it's very hard to be very accurate. As a manual therapist, I say we look at it objectively, look for the basics, and if we need to investigate further, that's fine. We can refer on. Mouth exams, again, now I'm not asking you to look into the patient's mouth like a dentist would, but something simple as looking around the lips, looking for discoloration of any sort of bluish tinges, any central cyanosis, any significant inflammation around the mouth. And do you know what? Something simple as, what's their dental hygiene like? Have they lost teeth? Are they significantly discolored? Have they got poor dental hygiene? Again, these are simple tests that we can do. That doesn't necessarily mean that they've got an underlying health condition. But when we start building the bigger picture, then we start thinking, actually, maybe we need to refer this person. Now, peripheral swelling, very important. We look at the patient, we look at sacral edema, and we look at the legs, and we look at the feet, and we look for things like pitting or non-pitting edema. Has this person got swelling? If we press into it, does it stay depressed for any period of time? Swelling and peripheral edema, again, is something that I would be concerned about as a manual therapist, and it would be something I'd be asking the patient much more questioning around. Do we need to refer this person back to their general practitioner? Now, these guys are very general screening tools. I think it's very important as manual therapists, we look at the person objectively as they walk through the door. What information can I get from this person before I've even asked them a question? Now, remember, because patients don't always tell you the truth. They forget things, they miss things out. So it's down to us to try to make sure that we're asking appropriate open questions. We're using all of the resources we have at our disposal. What do they look like? What is their general health or their general healthy appearance to be like? Is there anything obvious, discoloration around the lips, the hands, any peripheral swelling? What's their general skin tone like? Do they look unwell? Do they sound unwell? Do they have shortness of breath? Do they have anything that may indicate a underlying health condition? Are they clinically obese? Are they unhealthy as a person? Do they have family history that may make them more predisposed to these sort of conditions? Now, guys, this is a very short list. It's not an extensive tool, but it's something that you can start thinking about adding into your clinical practice. And like I said, if in doubt, refer. You'll never be criticized. You'll never be criticized if you are cautious. I would rather the doctor turn around and go, listen, thank you for the referral, but your patient's absolutely fine, than me think to myself, well, actually, I've done all these screening tests, I won't worry about it. And then 5 to 6 weeks later, things haven't changed, and I'm having to refer, and I've lost time. So ultimately, if in doubt, always refer to a medical professional. These slides will be available for you to download and look a little bit more in depth afterwards.